Welcome to the Society for Surgery of the Alimentary Tract's Resident Corner on Letters of Recommendation and Personal Statements. Dr. Sujata Gill and myself, Dr. Jamil Stetler, will be your host for this presentation. Let us begin our discussion with the topic of letters of recommendation. In this portion of the presentation, we will discuss tips for obtaining a strong letter of recommendation, including when and how to ask for one. We will give examples of what makes a letter of recommendation stand out instead of ordinary or generic letters. We will provide advice on how many letters you may need, as well as who you should ask for one from. Be sure to express interest in a particular field as early as you can and seek mentorship. When on a related rotation, it is important to impress the entire team, from medical students, co-residents, fellows, and nursing staff, in addition to the attendings. They all talk to each other about your performance and attitude. Be active and not passive in your role. Ask for feedback and give yourself time to show your improvements. When it comes time to ask for letters of recommendation, whether to apply for a fellowship position or a job, start by setting up a meeting with the person you would like to be a reference for you. Be sure to bring an updated copy of your CV. Be sure this person has plenty of time before any deadlines and provide means for the submission of the letter. Pay attention to the conversation and be honest in your request. If the response of the person you are asking for a letter from seems lukewarm, don't be afraid to decline the letter or simply not use it. The elements of a strong letter of recommendation should include some of the following. It should highlight your strengths and skills, or your accomplishments, or describe something unique about your personality. It should tell a story to capture the essence of who you are, or it should put you in context of your peers. Otherwise, the letter will be generic. Here are some examples of good letters which highlight a unique attribute of the applicant. Well-regarded member of the team and got along with students, residents, and fellows very well. Was deemed by all who supervised to be thoughtful and caring. Showed above-average technical skill. Is extremely smart and well-read and answered very difficult questions, showing an unusual depth of knowledge relative to peers. Demonstrates an eagerness to seek out opportunity and experience. Demonstrated flexibility and quick ability to adapt to different circumstances and to do multiple tasks. Has received compliments from staff and patients alike for her professionalism and compassion. Quick learner, clearly not afraid of hard work. Other important elements in a strong letter of recommendation include superlatives. These come in various levels, such as did well versus ahead of others versus the best. A program wanting to keep you around is a good statement. Overall, the letter should reveal things about you that other items in your application, such as test scores, do not. Here are some examples of strong superlatives. Has natural tools for surpassing expectations. Evaluations from the faculty were from close personal interactions. I am writing the strongest letter possible in support of. On a personal note, I am proud to have had stellar person, incredible gifted clinical surgeon. We will work to keep in our program. I would consider a top candidate. Is someone who will make meaningful contributions to surgery and patient care. Happy to stand in the OR with or be operated on by. So how many letters should you obtain? This depends on what and where you are applying to and the associated specific application process. In general, most of the time, 3 to 5 letters are needed. Good choices for letter writers include your program director. Get to know him or her during your program tenure. Often this letter can be more personal than the one from your chairman. A surgeon in the field you are applying to. A research mentor whom you completed a project with. Any other mentor who knows you well and will write you a strong letter. If possible, try to have a person write you a letter if they have connections to the institution you're applying to. Remember, the world of surgery is a small one. Having one of your letter writers call your top place of interest, especially if he or she has connections to that institution, can help you go the extra mile in obtaining your desired position.
We would now like to discuss the personal statement. In the following slides, we will review the do's and don'ts in writing your personal statement, how to organize it, as well as ways in which to keep it polished before submitting it. Let's begin with what you should do with respect to drafting your statement. Remember, most people reviewing your application will read the first few sentences of your personal statement, skim over the middle, and then read the end. If you tell a good story and grab the reader's attention, then they are likely to actually read the entire statement. So keep it organized, concise, and under one page. Interviewers will often ask you about the content during the interview, so be prepared to talk about what you say in it. Gear the statement to the audience you are presenting it to, and focus on what is unique about yourself and set yourself apart from the other applicants. Everyone knows you want to do surgery already, so don't state the obvious. Avoid any controversial issues. Don't simply repeat what your CV already states. Ensure that there are no grammatical errors. Avoid stereotypes and cliches or arrogance. Do not wait until the last minute to write it. Give yourself plenty of time to revise it. And do not underestimate the importance of this portion of your application. Keep in mind that your reader has a short attention span, so tell a story and get to the point. Keep the font simple and choose something like Arial or Times New Roman. Keep the font size to about 12 with 1-inch page margins and make it single-spaced. When organizing your personal statement, think about it as having 3 parts: a beginning, a middle, and an end. The opening should grab the reader's attention. The middle should focus on who you are and what makes you different from other applicants. The end should let the reader know what your career goals are. Here are some examples for your opening. Do what is unexpected. For example, as a native of Missouri, one of my personal heroes is the 33rd President of the United States, Harry S. Truman. And don't state the obvious. For example, I have been drawn to colorectal surgery due to the breadth of practice. Here are some examples for the middle portion of your statement. Be sure to highlight what makes you stand out as an applicant. For example, will enable me to create a niche with additional expertise. I have already invested effort into making myself a better teacher. Do not simply describe what your CV already states. For example, passion for oncology is evidenced by my postdoctoral research time being spent studying tumor immunology. Here are some examples of concluding your statement. Be sure to be specific about your career aspirations. For example, for all of these reasons, the deep satisfaction of helping patients, research and education opportunities, and the promise of innovation, I am determined to pursue a fellowship. Do not be vague and leave the reader wondering what your ultimate goals are. For example, I feel the vision I have for my career is now starting to become reality. If you are interested in academics, research, private practice, etc., say so. It is okay if these goals change over time. Just be honest in where you see yourself at this current point in time. Keep in mind that program directors read hundreds of personal statements, so make sure yours stands out as a good statement. Simple ways to do this are to proofread it and have someone else read it. Be open to their suggestions and make edits. Here's a list of some good choices of who to ask for feedback from before you finalize your statement for submission, such as a co-resident, a mentor, a program director, or someone who is recently successful in obtaining the position that you are applying to. As an added tip, consider thanking or mentioning your mentors by name in your personal statement. This concludes our discussion on letters of recommendation and personal statement. We hope it has been informative and in some way helps you to succeed in your application process. At this time, we would like to take a moment to thank the following contributors to this presentation. Their input was vital to creating a presentation with expert and experienced advice. If you have questions or need further guidance, please do not hesitate to contact us. We will be happy to assist you the best we can. Thank you for your time and good luck.